Welcome to Wellness Wednesday. So today I'm actually going Instagram Live and Facebook Live at the same time. I'm a techie, I'm getting good at this. So welcome to Wellness Wednesday. A couple of reminders. I want to remind you about the Healing Diva Retreat in Atlanta in September. It's an amazing retreat. If you've never attended, I encourage you to come. Every year they keep getting better and better. This is year number 5. And so we're seeing some amazing inquiries about it. We've got 3 great speakers, Dr. Naisha Winters, Dr. Anna Kabeka, and Dr. Tony Jimenez from Hope for Cancer. It's a great place for women to come together, whether you're preventing or whether you're healing breast cancer. This is the place to come because it's a room of like-minded women. We dive into the 7 essential system. We do some group work, we give lots of hugs, we dance, we cry, we laugh. It's an amazing 3 days. So make sure you, make the effort to come. It's in Atlanta, September 13th, 14th, 15th. Just go to breastcancerconqueror.com and click on the retreat. We also have a contest going on for the retreat. For those of you who have been and are coming, if you invite more friends, then you have the opportunity to win some super duper prizes. So look that up, and we've got some great things happening. And then secondly, I want to mention My Breast Friend. So My Breast Friend has officially launched. My Breast Friend is an early detection kit. We all want to prevent cancer as much as we can. This is a training system to teach you what to feel for and how to feel it. You don't just go around poking in your breast. There's a whole system to learning. The average size lump that is found by a woman who is not trained in a breast self-exam is the size of a ping pong ball. Believe it or not, that happens all the time. Women that are trained in a proper breast self-exam using the Mammocare method, aka My Breast Friend, can find it the size of a small pea. Size matters when it comes to breast cancer, because if you find a lump that's the size of a pea or smaller and it hasn't spread, you have 15-year survival rate and 88% chance of surviving. So size does matter. MyBreastFriend.com. Make sure you go to the website to learn more about it and get your model and start doing your breast self-exams. If you do exams with your doctor once a year, or you do a thermogram once a year, that's awesome. However, there are still 364 days of the year where your breast tissue can change. So make sure you become proactive. You take charge of your body. You get to feel your breast tissue every day if you want to. Your doctor is going to feel your breast tissue once a year. So make sure that you take advantage of My Breast Friend. It comes with an instruction manual that will teach you the basics, and there's also a 20-minute instructional video that teaches you how to do it properly. Hello everybody on Instagram. I'm waving back at you. And hello everybody on Facebook. Great to see everybody there. The next thing I want to talk about are the 7 cancer triggers. We're talking about prevention. Sorry about that. I forgot to put the do not disturb sign on my phone. Somebody just called. Okay, so we're talking about how to prevent breast cancer. Prevention is kind of a hard sell because nobody wants to think about, oh, I just want to prevent cancer. I just want to prevent disease. Trust me, if ever you've been faced with breast cancer, you know somebody who's been faced with breast cancer, you want to do everything you can to prevent it. And so in my newly published 2nd edition of the book, Heal Breast Cancer Naturally, you can find this on Amazon. It should be available in Audible as well very soon, but it's in Kindle and paperback. Great book. #1 bestseller in 10 categories. You can't hear me. Wonder why. Don't know why you can't hear me. I don't know why you can't hear me. No sound. I have no idea. Okay, well, I have no idea why you can't hear me because I just did an interview and it worked fine. So sorry about that. I guess I will just end the live video and go with Facebook. Okay, so as I was saying, second edition of the book is a #1 bestseller in 10 different categories and in 5 countries. So I guess there's some good information here. Very proud of it. Talk about my first and second journey and everything you need to do following the 7 essential system. So let's talk about the 7 triggers. Did you know that breast cancer is the second leading cause of death when it comes to women? 1 out of 8 women are destined to develop breast cancer in their lifetime. Now, cancer is a preventable disease. Only 5 to 10% of cancers are actually genetic. The rest is all environmental. So there's a lot that you can do to prevent breast cancer. So let's look at the triggers. So trigger #1 is the SAD food, SAD, Standard American Diet. We know that food, #1, is foundational. And when you ingest junk food, chemicals, your health is going to reflect that. Excessive sugar consumption. Did you know that the average person eats over 52 teaspoons of sugar per day? That's 100 pounds of sugar per year. So the first thing you have to do is avoid sugar. And there was actually a study done. It was a Canadian and US joint study where they looked at 600 menopausal women, and they found a direct relationship between high insulin resistance, too much sugar in the body, and breast cancer. So make sure you reduce your sugar consumption. Bad fats and oils. When we look at processed foods, there's too many bad fats in our foods that can literally suffocate your cells. Look at all the hormones and the antibiotics that are in foods. Those can be very, very toxic to your body and add what we call xenoestrogens. Overcooked and processed foods. Now there's something very interesting called acrylamide. Acrylamide is a chemical that's produced when food is overheated. Did you know that potato chips have so much acrylamide that California is actually thinking of putting on the label that it's carcinogenic? So according to the analysis, high levels of acrylamide are actually causing cancer. So there's lots of foods out there. Anything that's fried, anything that's artificially made, that comes in a box, those things are often overheated. Second trigger is environmental toxicity. The average person has over 127 different chemicals that they're exposed to just from their body care products alone. The shampoos, the makeups, the things they put on their skins, the soaps that they use. So make sure that you're aware of the toxicity in your environment, in your home, what you put on your skin, and what's around you. Another big toxin is electropollution. We hear more and more about that, and especially with 5G rolling out, electropollution needs to be addressed. There's lots of technology, lots of tools out there that can really help you with that. And ladies, never ever use your bra as a cell phone carrier. More and more women are discovering breast cancer as a result of keeping that cell phone in their bra. Non-ionizing radiation is right there against the breast tissue, and your breast tissue is very sensitive to that. Trigger #3 is physical and hormonal stress. If your hormones are out of balance, then guess what? That's going to increase your risk for breast cancer. If you're estrogen dominant, or if there's too much progesterone in your body, or if your estrogen and progesterone ratios are off, or your estrogen ratios are off, guess what? That can lead to breast cancer. And chronic stress. If you're chronically stressed and you have the pedal to the metal, that means your body is pumping out a lot of adrenaline, a lot of cortisol, and studies have shown that adrenaline can increase your risk for metastasis and spreading of cancer. Trigger #4 is the emotional wounds. Now, if you don't manage your stress and you're thinking lots of negative thoughts and you're living in the past instead of living in the present, that's going to increase your risk for cancer on an emotional level. Dr. Douglas Brody, MD, was a doctor who was a pioneer, way ahead of his time. He worked with cancer patients for over 20 years, and he found that there were some basic traits that women had, or people had in general, when they had cancer. And I'll read a few of them. Some of the basic traits that were connected to cancer patients. Number 1, being highly conscientious, responsible, and hardworking. Number 2, being someone who worries for others. Number 3, being a people pleaser. Number 4, having poor relationship with your spouse or with your parents. Number 5, internalizing toxic emotions and not being able to manage your emotions and expressing your emotions properly. Number 6 is not coping with stress properly. And number 7, having deep-seated emotional issues that are never addressed. Does that sound familiar? Do you keep stuffing your emotions? Do you keep stuffing the past and you don't deal with it? I love what Dr. Lisa Rankin said. She said, if you don't grow, you grow a tumor. There you go. Essential or trigger number 5 is dental toxicities. There is no safe level of mercury. If you have amalgams or silver fillings in your mouth, make sure you work with a biological dentist. Mercury is the most toxic element on the planet, and it releases methylmercury in your body. I don't care how old they are. Go to YouTube, smoking teeth, and you'll see a 25-year-old amalgam in a tooth and how it's releasing methylmercury. Root canals. Root canals are toxic. They're like a dead organ in your body, releasing lots of unhealthy bacteria and toxins as a result. So from a chemical point of view, you have to look at what's in your mouth. From an energetic point of view, your teeth are connected to your meridians through the acupuncture meridian system, and they're connected to your organs. So if you have problems with the 4 teeth up here, 4 teeth up here for breast, 2 down here, 2 down here, those are the breast meridians. You can look online, find a dental chart. You'll see that there's a direct connection to your teeth and your breast tissue. And I can tell you, both times, I had breast cancer twice, both times there was a dental connection on that left side where the breast tumor was. One was an infection and a cavitation. The second one was a root resorption, a dead tooth that sat on number 14 that I did not know I had because of an autoimmune issue that I didn't know I had. And that has an inverse relationship with breast tissue. Number 6, the 6th trigger is inflammation and methylation. Hello, everybody. Thanks for all the love and all the stars. Send me some questions if you want towards the end, because I'll answer some questions. Thanks. Yeah, people were not hearing me on Instagram Live. I don't know why, but anyway. So trigger number 6 is inflammation and poor methylation. So we know that inflammation is the root cause of all disease, right? It lays the foundation. So what are some causes of inflammation? Smoking, drinking, sleeping deficit, if you're just, burning the candle both ends and you're not sleeping properly, environmental toxins, unsaturated or saturated fats that are clogging up your system, chronic elevated blood sugar, and chronic stress. All those things can lead to inflammation. Now, methylation, what is methylation? Methylation is your body's ability to take certain substances and break them down into other substances. So, for example, serotonin in your gut is methylated and broken down into melatonin, which helps you to sleep and helps to prevent breast cancer. Now, methylation can be a problem if you have some genetic SNPs like MTHFR, and you're not breaking down your estrogens properly. The same thing can happen. You should break down your estrogens into metabolites that are not dangerous. Well, if you have a methylation problem, guess what? Then that can increase your breast cancer risk because you have more aggressive estrogens floating around in your system. I learned about methylation the hard way. I had homocysteine levels that were at 21, which is heart attack and stroke waiting to happen, even though I was eating well, even though I was a runner. When I discovered high homocysteine levels, I discovered what methylation was all about. Now that I support my methylation process every day, my homocysteine levels are around 7. And so make sure you get checked when it comes to your methylation. Check for homocysteine and C-reactive protein, and ask your doctor to do some genetic testing on you. All right, last trigger, trigger number 7, needles and knives, lotions and potions. So you may be surprised to find out that tamoxifen and radiation are categorized as carcinogenic. Yes, if you look up tamoxifen on the American Cancer Society's website or the World Health Organization, it's labeled a carcinogen. Unfortunately, many of the tools that traditional medicine uses, and I'm not against traditional medicine, it's done some great things. However, it does some things that are not so great after all. For example, if you choose to do chemotherapy, and I'm not telling you not to do chemotherapy, you have to understand what chemotherapy is actually doing. It's destroying the tumor, but it's not getting to the root cause. Chemotherapy and radiation can actually increase your recurrence of breast cancer because it creates resistant breast cancer stem cells or baby cancer cells that can cause recurrence. We know, according to a study, there was a study done by the Department of Radiation Oncology of Sydney, Australia. They looked at 22 major adult cancers in the US and in Australia, and the overall contribution of curative and adjuvant cytotoxic chemotherapy on the 5-year survival rate was 2.3% in Australia, 2.1% in US. So what does that mean? That means if you do chemotherapy alone, that can only give you a 2% increased survival rate. There's a lot of other things that you can do. What about CT scans? We know that CT scans can be beneficial at times, but they're way overused. And we know that according to research and studies, that CT scans may be producing 29,000 future cancers, 6% of them being breast cancer. Dental x-rays, are they always needed every 6 months or every year? I don't think so. I'm not a dentist, but I personally don't get them every year. Mammograms. I'm not going to tell you not to have a mammogram. However, we know that radiation causes cancer. Radiation compression cannot be good for your breast tissue. However, if you do choose to use mammography, make sure that you use thermography or ultrasound as a backup. Never rely on one source. There was a 23-year study done on hundreds of women that was published in the Women's Health Journal, and they found that mammograms found lumps 43% of the time. A breast exam found it 43% of the time. When you add a clinical exam, it brings it up to 56%. So touch is actually more effective than just a machine when it comes to finding lumps. What about a biopsy? I'm not going to tell you not to have a biopsy. Some women just want to know what's there. But keep in mind that according to John Wayne Cancer Center, they've stated the fact that when you penetrate a tumor with a needle biopsy, you are breaking that barrier which can spill millions of potentially dangerous cancer cells into the bloodstream. So if you do opt for biopsy, make sure that you really protect yourself from the side effects. Modified citrus pectin is a great thing to use before and after because it makes the cancer cells less sticky, so there's less chance of spread and metastasis. And the last thing about the breast cancer triggers is to understand about the pink frenzy. Now, I'm not against the pink movement in that they've really created some great tools for women to understand. However, when it comes to actually helping women to really be proactive and really teach true prevention, I have to say that they've got a lot of work to do. So understand that being proactive with prevention means taking responsibility for your health. Nobody's going to take better care of you than you, so learn to do that by doing at least monthly breast self-exam. I recommend every 2 weeks, because even if you do your mammograms every year, or your thermograms or your ultrasounds, there are still 364 days of the year where your breast tissue can change. All right, so let's look at some questions that we have here. Oops, okay, so Nikki, with regards to the fillings, isn't removing them dangerous? When they drill into teeth, particles disperse and actually get swallowed. Great question, Nikki. So when you have your amalgams removed, always work with a biological dentist. On my website, breastcancerconqueror.com, on the blogs, essential number 5, I actually have a list of 10 questions to ask your biological dentist to make sure that they're the real deal. You want to make sure that they use a rubber dam so nothing else is exposed except for that tooth, and they have high mercury vapor filters that they use to suck up all those little pieces, that they use the proper equipment. There's a method to it, and if you don't do it properly, yes, it can be very toxic. Great question. Dr. V, do I have a root canal? Shall I take the tooth out and then? If you have a root canal, if it were me, I would take the root canal out. Now, I'm not a dentist, so that's the caveat, but if it were me, I would never, ever have a root canal in my mouth. I would have them removed by somebody who knows what they're doing, and then don't jump back into the fire by getting an implant, because an implant is no different. It's a piece of metal that's drilled into the bone that can create an active site of potential infection and bacteria. What do you take to improve methylation? Well, first of all, you have to find out if you have a methylation problem, and you do that by doing some DNA testing or checking your homocysteine levels and your C-reactive protein levels in the blood. Those are kind of simple ways to check for inflammation caused by methylation. There's basic things, so ground flax seeds, certain B vitamins. We actually have a great product in our store called Methyl Support. It has all the B vitamins, TMG, trimethyl glycine, I believe it is, and some other cofactors that helped the body to methylate. Fermented soy also helps methylation process. Broccoli sprouts, Broccoli Power, sulforaphane, great products. Do I have a root canal? Should I remove it? Let's see. Next question. I'm sorry. You're looking beautiful. Love being able to hear your knowledge. Thank you so much for sharing with all of us. Thank you, Katie. That's really sweet. I appreciate that. Any remedy for chronic post-nasal drip? Well, nasal drip is a lymphatic issue, and that's a toxicity issue. It could also be a colon issue, because there's a lot of lymph glands in the gut, and energetically through the acupuncture meridian system, your gut and your nasal cavity are connected. So if you've got lots of postnasal things, I would look at food allergy testing. I would look at your toxicity levels. I would look at improving your microbiome, checking your microbiome to see if you have all the healthy bacteria that's needed. Is soy milk safe? Personally, I don't think soy milk is a good thing to do. However, if you eat soy that's non-GMO and organic and fermented, then it's much better for you. If you eat the whole edamame bean, for example, that's a whole soybean, that's actually been shown to have a protective effect against cancer, and it actually has been shown to reverse BRCA gene in a I believe it was in a mouse model. So it can be a very powerful adjunct, but don't be eating a lot of soy, soy nuts and lots of soy milk. Look at the Asian culture. Soy has been a staple in their diet for thousands of years, and if they continue to eat traditional diets, then their breast cancer rates are lower. I have terrible anxiety. This is from Carrie. I have terrible anxiety and constant stress. What's the best way to deal with this? Well, Carrie, that's a long-winded question. The first place I would start would be to really try to get centered and to ask yourself why the anxiety, and start journaling. Get very quiet and ask yourself, why are you anxious? what is happening in my body. Where do you feel it in your body? If you're not familiar with EFT, I would suggest you go to thetappingsolution.com or EFTuniverse.com. They have great videos and great tools for you to learn. EFT helps to calm the fight or flight anxiety in the body. It's a tool that I used through both healing journeys. I use it, I can't say I use it every day, but I use it many times during the week to help lower stress levels and to get very clear about my life. There's a great section in here in the book, Essential number 4, Heal Your Emotional Wounds. A lot of times when we have chronic stress and chronic anxiety, it's because we haven't addressed the root cause. And I would encourage you to work with somebody professionally to help you to get to that root cause. All right, everybody, I think that's all the questions. Join me every Wednesday for our Wellness Wednesday and for Cancer Answers. Next week, I'll be diving into each of the essentials. I'll be diving into essential number 1 and what it can do to support you in your preventative or healing journey. Remember the Healing Diva Retreat in September. Remember to look at mybreastfriend.com to learn the geography of your breast and to really be proactive with your health. This is Dr. V sending you a big healing heart hug. Mwah. Bye, everybody.